PoET stands for the Prevention of Error-Based Transfers, and by error we mean consent-related errors, and by transfer we mean transfers from long-term care to hospital. We started with an assessment where we looked at data that was available through the hospital to see what happened to long-term care residents after they were transferred to the hospital.
Residents were moving even when they didn't want to, when there weren't services there that could benefit them. The PoET project tries to improve decision-making prior to a transition that a resident might need to make or want to make from where they are to acute care.
It includes within it mechanisms that can help to resolve disputes that can get in the way of the resident or the patient receiving the care that they want and can benefit from.
The data has shown that we've made an impact, both on the health system and I think also on residents.
Information in and of itself is not going to make the changes that are required to bring decision-making and behaviors and habits and policies in line with the Healthcare Consent Act.
The resident, the person, the patient doesn't experience health care in one place. They experience the whole system, and I think they'd like to be supported wherever they are in that health system well. The PoET project offers an important piece of that kind of support for a resident.
Although it's difficult at first, in the end it makes things easier for everyone.
It brings the voice of the resident, of the person for whom we are trying to support, to provide care, to the forefront of decision making, that we never forget, ever, that it's about a person in front of us, and that person has wishes, beliefs, and values that are important to them. And knowing what those are is one of the things that PoET can bring forward